Accurately capturing raw scan data of maxillary and mandibular arches can be achieved in one of two ways. The first method is by scanning the patient's mouth using a preferred intraoral scanning device and associated software to capture critical topology of the affected region of the mouth. The second method to capture raw scan data is by scanning a fully cured dental stone model poured from traditional dental impression systems using a high-resolution desktop dental scanner. Import raw scan data to your preferred dental design software suite to produce 3D bite splints, night guards, and corrective appliances. Orientate bite splint or corrective appliance designs at a 30-degree angle with the intaglio surface facing away from the build plate. Place the supports opposite of the intaglio surfaces. Avoid placing supports within adaptive sensitive areas, as this could cause discomfort to gingival areas and can prevent the night guard or corrective appliance from fully seating. The recommended minimum support diameter is 0.3 mm at the point of contact where the support meets the restoration. The recommended minimum support height is 2 mm for ease of splint removal from the build plate. 3D printing resins contain chemicals of different weights, therefore, it is essential to thoroughly mix the resin prior to printing. Before dispensing the resin from the bottle, use a plastic spatula to stir the bottom of the bottle for 1 minute or use an automated bottle roller for 10 minutes. If the bottle has been in storage for excess of a month, it is recommended to roll the bottle for 1 hour to allow the chemical components to mix thoroughly. Once the vat is filled with the mixed resin, send the design to print. After completion of the print job, remove the build platform from the 3D printer and then remove printed appliances using a spatula. Wash prints in 99% IPA in a vortex or ultrasonic bath for 5 minutes, then move semi-clean parts to a secondary vortex or ultrasonic bath with fresh 99% IPA for an additional 5 minutes. Do not expose bite splints to IPA for longer than 10 minutes total to prevent losing the material strength. Use compressed air to remove excess IPA and any residual uncured resin. Repeat washing and drying until the restoration is thoroughly clean, leaving a shine-free matte finish. Remove supports with clippers or break away supports with fingers. Remove remaining support tips from the printed appliance with a low-speed handpiece and a rounded carbide burr at low speed. Remove residual fibrous material from the printed appliance with compressed steam and dry with compressed air. Apply Rodin glaze to inner and outer surfaces if not polishing with conventional polishing techniques. Follow the recommended time and temperature schedules if applicable when using light curing devices. The Otoflash G171 with nitrogen hookup is the recommended light cure device of choice for best clarity and enhanced mechanical properties. Post-curing must be performed to be in compliance with FDA. After light curing, recheck the splint or corrective appliance's fit, occlusion, and contact areas for any further adjustments. Thank you for using Rodin Splint. Due to its very high strength and resistance, it is ideal for patients suffering from acute bruxism and night grinding, and can be prescribed for both bite splints and snoring appliances. To learn more about our line of Rodin resins, please visit www.rodin-3d.com.